This is the graph that tells BC's COVID-19 story so far, as new modeling out today shows that BC is, in fact, flattening the curve. These gray and green lines are the number of critical care cases that health officials plan for based on lessons learned in the Hubei region of China and in northern Italy.
But here is what actually happened, and it is remarkable. The purple line showing the number of British Columbians needing critical care is far below some of the worst case scenarios. Good evening. That is the difference between what could have been and what did happen. And Dr. Bonnie Henry says the credit goes to all of us. That dramatic difference between dire projections and reality is the clearest sign yet that our province is slowly winning this fight. CTV's Binder Sudjan has our top story.
In the fight against an unprecedented pandemic, progress.
And we have cautious optimism about a downward trend, but only cautious optimism.
Health officials releasing data showing what happened after drastic restrictions on travel, schools, and social gatherings were put in place.
Once we got to the 2 weeks from when we put those measures in place, we start to see a gradual decline in the number of new cases. That's our bending the curve.
Thanks to actions taken by British Columbians, she says new cases are growing at about a rate of 3 to 5%. Still, many people, including seniors and elders, are in hospital and fighting for their lives.
So it is unfortunately the truth that we are going to see more people die from this disease in the coming weeks here in BC.
The health minister says even if BC suddenly had a surge similar to Italy or Hubei, beds and ventilators would be available. If the curve remains stable, the healthcare system has some breathing room.
This is going to be not just weeks, but months and conceivably years. We must find a healthy way forward for the next 12 to 18 months.
Plans are being worked out on slowly resuming elective surgeries and getting at least some kids back into school with strict physical distancing measures. The government expects to release details on easing restrictions in a couple of weeks.
I will caution, though, it is not going to be the same. We are not going back to, right now, what we had in December. It's not going to be the same.
Okay, Binder, so the modeling shows we are flattening the curve in BC so far. What does it tell us about what's ahead in the next few months?
Well, if that trend continues, and that is the key, a relaxing of some of the rules. So Dr. Henry talked today about relaxing travel rules within the province. She also talked about certain businesses perhaps being allowed to reopen if they could meet the public health criteria. But the danger here and what their models are showing them is that if they act too quickly or lift those restrictions too quickly, that we could essentially erase all of the good work that has been done so far. That, of course, is something that they want to avoid. So for now, nothing changes. Stay at home if you're sick. Avoid non-essential travel and just take all those same measures that we all have been taking for the last month or so.